All right, so let's talk about why we screen and how we score. So with movement screening, I basically like to compare it to a pre-flight safety check. It makes sure that things are working right before we add more complexity, which in training is load and speed to the body. We want to do it standardized and consistent each time, except for one test, which we're going to go over. And the thing with movement screens is they allow us to catch problems before they can escalate, but it also allows us to figure out what someone can do in the gym, what they can't do yet, and what they need to do. That is the main thing that we need to look at. It's not necessarily a tool of diagnosing or identifying injury risk. Okay, it's identifying constraints in performance, and we can identify the constraints in someone's performance, and we can solve that problem. They're going to have a higher performance threshold that they can achieve. Let's use hip flexion and hamstring length as an example. Okay, so for that, let's just say someone does active straight leg raise and they have terrible hip flexion. So that's going to limit them to do a deadlift position or remaining in deadlift position and other beneficial hip hinge exercises. Now we can put them into a full deadlift initially, and we can do that, and they will adapt and they will learn over time. Although my argument would be is that since they're learning from a compromised position, it's going to take a lot longer for them to get there. Why wouldn't we just spend a couple of weeks and a couple of sessions actually improving that movement quality so then when they go to learn the deadlift, they don't have a physiological constraint stopping them from learning it and they can concentrate entirely on motor learning. It seems to be a far better approach in my mind than what a lot of people are talking about. So with scoring, we have four stages for each one. We have a score of 3, a score of 2, a score of 1, and a score of 0. Okay, we want to have an objective and measurable result. So a score of 3 is basically the client doesn't move perfectly, no restrictions or imbalances, they're relaxed, normal breathing, it's ideal, it's perfect. We do not need to stress about it. Now, score of 2 is a client can perform the movement, there might be some restrictions. So in the squat, they might not be able to um, for example, squat all the way down and look good with their heels flat, but as soon as they elevate it, they're okay. So slightly less range of motion, or they need a little bit of compensation to help perform the movement. I think it's acceptable for most people. Target score for most individuals, it does have room for improvement, but it means that we can train and we'll probably get there anyway from good training. We may want to move someone to a score of 3 if they have high end goals initially. So if they want to get straight into Olympic weightlifting, we may do that initially. But for most people, a score of 2 means they're good to go. Score of 1, the client cannot perform the movement at all, or their range of motion is pretty compromised. There's some significant restrictions going on, either from a length tension or neuromuscular recruitment issue. We need to solve those problems before we load it. Reason for that is we're just not going to have effective motor learning. If we don't have effective motor learning, what will happen is that the client probably won't feel too good about it moving forward, and it can potentially be detrimental to their long-term process because they're not as engaged in it. The score of 0 means there's pain. Okay, so if a client experiences pain, that is a red flag because if they're just getting pain, doing a bodyweight squat or lifting their leg up, that pain is more than likely going to be exacerbated by adding load, frequency, and speed. So we need to figure out what's going on. Now, a lot of the time, pain doesn't necessarily indicate a major concern. It could just be something just aches for whatever reason. So we can go through our other assessments and then do some correctives. If that pain moves away, happy days. If not, they may need to get further assessment if necessary. Now, a few extra considerations that we may have to do is I always generally tend to score conservatively. We're not trying to win here. Okay, there's no win for this. There's no prize for having the best movement screen. So if it's nearly a 2 but not quite there, give it a 1 because that week of corrective movement will probably get them up to a 2 very, very quickly and they'll progress so much faster. Be objective. Don't put someone's pride or comfort over their movement quality when we're doing exercise programming. It doesn't make any sense. And then the next one is breathing patterns. So if someone is, holding their breath and really, really tense, doing a really relaxed movement, it's probably a sign that they don't really control that movement as well as what they think they would. So we need to make sure that we look at their breathing patterns. If someone has normal, relaxed breathing, it shows they have full control over that movement pattern. So guys, that's why we use movement screening and the scoring system. Make sure you remember this when we go through each and every test when you're looking at what we're trying to assess.